Hi, this is Dein, live from ACR Convergence Day 2. One of the sessions from this morning that is available on demand for anyone that has missed it was a great session on ACR Advocacy, and I'm joined by two of the stars from it. We have Dr. Christina Downey and Dr. Kaitlyn Brittan, who are the heads of the Governmental Affairs Committee and the RheumPAC Committee. Tell me what's new. There was obviously a big election. There was a lot of people that were interested in this talk. Where do we stand in terms of the government that's wrapping up and the government that's starting?
Yeah, I think there's a lot of anxiety about the changes that are coming and trying to foresee and kind of read the tea leaves of what's going to happen. And while that is very important to anticipate the future, we still have to work in the Congress that we have right now. So the lame duck session is still in session, and there are about 20 working days left for us to act on some of the priorities that have already been set and have bills that are moving in the House.
And what are the top priorities that ACR sees as what's affecting rheumatologists and what we can get done?
Absolutely. So number one is Medicare reimbursement. So as you're aware, there have been cuts to the physician fee schedule every single year, and 2024 was no different. But there is a bipartisan bill that's in the House right now that we are hoping will go ahead and get through to the finish line and get on President Biden's desk so that he can sign it. And that one actually mitigates some of the cuts that we have seen. The second issue is telehealth. So telehealth has become critical in the way we practice medicine, and it's on the chopping block. The expansion that was put in during the COVID era is coming to a close December 31st, 2024, unless there is action. So there is a bill that's moving. It has both House and Senate bills, again, hoping to get it through the finish line and have President Biden sign that so that we can continue to reimburse for the services that telehealth provides, at least for the next 2 years. And then obviously the long-term goal on both telehealth and physician reimbursement is to get something in place where we're not having to kick the can down the road every single year, and that we have some meaningful long-term reform. But right now, those are the priorities that actually have a very realistic chance of happening with the right amount of support from our members.
And it's good to know that there's the ACR committees and the staffers that are working on it. If you're a rheumatologist that's watching this, what can be done? What should a rheumatologist know about what they can do to help out?
So I would say go to rheumatology.org and click on the advocacy link and send letters to your legislators. They need to hear that this is important to us, and it's already pre-templated. It's an easy ask. All it takes is 2 minutes. And the other would be donating to the RheumPAC. The PAC is the vehicle by which we get that face time to explain the importance of these to the lawmakers, and having their understanding of the importance both to us and our patients really helps advance that policy so we can get them across the finish line in the next 20 working days.
Perfect. So it's all on rheumatology.org.
Absolutely. Rheumatology.org will get you to the PAC website, and it will also get you to the advocacy front page. And if you're interested in advocacy efforts and want to stay in touch throughout the year, sign up for the ACR at Work newsletter. It comes to your in-basket every 2 weeks. It has calls to action. It'll keep you abreast of any legislation that's happening, anything in the regulatory space, and really helps you take good care of your patients by knowing the best ways to navigate the system that we're stuck with.
Perfect. Thank you for your time and all the work on this. Stay tuned to Room Now for more coverage.